dermatomyositis. So remember dermatomyositis. So there will be involvement of the skin, and also the patients are going to have the involvement of the muscle. So inflammation will be there. Basically, this comes under connective tissue disorders. So myositis, proximal muscles are importantly affected here, where there is going to be difficulty of the tasks which are mainly related to the proximal muscles, like for example, combing the hair, climbing the stairs. So all this will be problematic. And what are the 4 clinical features? So I will tell you what are the important skin lesions which you should write in the examination. So first, remember, there are so many named signs associated with dermatomyositis. So first one you need to remember is called as Gottron's sign, where the patients are going to present with violaceous macular erythema over the interphalangeal joint and also metacarpophalangeal joints. You are able to see this violaceous macular erythema present over the interphalangeal joints and also MCP joints. Okay, at the same areas, if the patient is having small raised lesions, then these are called as Gottron's papules. Gottron's papules. Again, the site is going to be the same, IP and MCP joints. So these are the 2 names. I hope you can remember Gottron's sign, Gottron's papules. What are the other names which you need to remember? So here you are able to see these are the Gottron's papules. Okay. So next is heliotrope rash, which is simply the violaceous hue which can be seen periorbitally. The violaceous hue, it is called as heliotrope rash. And one more term which you can remember is it is called as mechanic's hands, where there will be hyperkeratotic fissures which are going to involve the sides and also tips of the digits. So here you are able to see this is the sides and also the tips of the digits, where you are able to see hyperkeratotic fissuring. And these patients are also going to have this erythema, violaceous macular erythema over the B area of the chest. So this is called as B sign. This is called as V sign. And the same violaceous macular erythema, if it is present over the upper back, we call it as shawl sign. So all these are important names which you should remember. So this is the shawl sign which you are able to see here. This is the shawl sign. And this is what is called as the Holster sign, where the lateral aspect of the thigh is going to show the erythema, violaceous macular erythema. This is called as Holster sign. So these are the important clinical features of dermatomyositis. I hope this video was helpful for all of you. If so, please do hit that like